Where is kidney placed? On anterior side or posterior side?
How is kidney related to other organs?
How is kidney covered?
What are the internal structures of kidney?
Kidneys are supplied by which artery and vein? What are the structures of hilus?
Skin of the anterior abdominal wall, superficial fascia, which is the fat layer. After that, you can see the muscular layer. For better understanding, the intestinal section and abdominal organs has been dissected out. The kidneys are situated on the posterior abdominal wall, one on each side of vertebral column behind the peritoneum. Here we see the covering of kidney known as fibrous capsule. The right kidney is slightly lower and forwards due to presence of large and bulky liver. The left kidney is slightly upwards and backwards due to stomach. The transpyloric plane passes through upper border of right kidney hilus and through lower border of left kidney hilus. The inferior vena cava and the abdominal aorta forms its branches to the right and left kidney. The 9 abdominal regions are formed by right lateral, left lateral, transpyloric and intertubercular lines. The kidneys occupies mainly epigastric, hypochondric, lumbar and umbilical regions.
As you all know that the right kidney is slightly lower than the left kidney due to presence of bulky liver. So according to that, right kidney reaches up to the level of 12th rib and the left kidney reaches up to the level of 11th rib.
Each kidney has two poles, upper pole and lower pole. You might think that axis of kidney is straight, but it's not true. Axis of kidney is downwards and laterally. Because of that, upper pole is nearer and lower pole is away from each other.
Now, the features of the kidney. Let's talk about the weight. The weight of the kidney differs in both males and females. In males, it is about 150 grams and in females, it is about 135 grams. As we all know that each kidney is a bean-shaped structure, so its dimensions are 11 cm, 6 cm and 3 cm respectively. Let's talk about the borders. Each kidney has two borders, the lateral border which is convex shaped and the medial border which is concave shaped.
The capsules of kidney from inside out are fibrous capsule, perirenal fat, renal fascia having anterior layer of fascia of Gerota and posterior layer of fascia of Zuckerkandel and paranephric fat.
Each kidney has two surfaces, the anterior surface and posterior surface. To identify the anterior and posterior surface, the structures from anterior to posterior are renal vein, renal artery and renal pelvis.
Now, the anterior relations of the right kidney. Right kidney is related to the suprarenal gland and liver on its upper part and duodenum and hepatic flexure of colon on its lower part.
Now, the anterior relations of left kidney. On the upper surface, it is related to left suprarenal gland, also called as adrenal gland. The upper anterior surface, it is related to pancreas and stomach. The lower end of left kidney is related to splenic flexure, descending colon and jejunum. On its upper lateral surface, it is related to spleen.
Internally, kidney is divided into two parts, outer cortex, inner medulla, which faces towards renal sinuses. There are 8 to 10 conical masses called as renal pyramids. Pyramids contains a base which faces towards cortex and apices which faces towards renal sinuses.
Renal cortex is outer portion of the kidney which is reddish brown in color. It is divided into two parts. First part is cortical arch which forms the caps over the pyramid. Part is column of Bertini which is extension of cortex into medulla.
Space into the kidney from hilus is called as renal sinus. It contains renal vein, renal artery and renal pelvis. The renal pelvis bifurcates into 2 to 3 major calyxes, which furthermore bifurcates into 7 to 13 minor calyxes.
Here you can see that this portion is called as the Glomrular Apparatus, which helps in urine formation and filtration of the blood. The portion of the uriniferous tubules proximal to the glomerulus is called as proximal convoluted tubule or PCT. In this portion, reabsorption of amino acids and glucose takes place.
Now, the next part is called as descending limb of loop of Henle, which is more permeable to water and less permeable to ions. The next part is called as ascending limb of loop of Henle, which is more permeable to ions and less permeable to water. The last part where reabsorption of water and ice takes place is called as distal convoluted tubules and collecting tubules respectively.
The glomerular apparatus is formed by the afferent arteriole, which is greater in diameter and comes out as efferent arteriole, which is lesser in diameter. This efferent arteriole further supplies the descending limb of loop of Henle and ascending limb of loop of Henle as peritubular network. The third disease is nephrolithialysis, also called as renal calculi, which is kidney stone. The next disease is nephritis. Nephra means nephrons and itis means inflammation. It is the inflammation of nephrons.
Now the other clinical anatomies are adrenalectomy, dialysis and renal transplantation.
आयुर्वेदानुसार किडनीला आपण वृक्क असे म्हणतो. वृक्काची उत्पत्ती गर्भावस्थेमध्ये रक्त व मेदाच्या प्रसाद भागापासून होते. हा एक मातृज भाव असून हे मेदोह स्त्रोतसाचे मूल स्थान आहे.
प्रमेय या व्याधीमध्ये व अतिमद्यपान केल्यामुळे मेददुष्टी होऊन कालांतराने वृक्काची कार्यक्षमता कमी होते.